My background, in a brief note, is my PhD is in psychology. My specialized area of study was adolescent mental health and drinking, kind of in the prevention sphere that we're going to talk about today.
Okay, so this is just a map of Oakland County, just to give you an idea of the scope of our coalition network. So everywhere you see a star is where we have a coalition. So these coalitions, they have their own separate board. They work separate from the alliance. We provide funding, work plan, resources, technical assistance, networking opportunities for these coalitions to operate within their local communities, addressing their local conditions. And as part of that, we provide evaluation. We help with their evaluation. We do countywide evaluation. We assist with some grant writing with them. So we're going to be touching on a lot of the things that we do to be able to evaluate the county as a whole, and then also be able to work with coalitions and assist them in the work that they do at the local level. So I'm going to talk a little bit here at the beginning about gathering the data that we gather, that we encourage others to be gathering, and then Darren's going to take on the lion's share of this presentation. So just to start out, we want to do a quick poll. How familiar are you with data collection strategies? So I'm going to pull up this poll, and bear with me because this is the first time I've ever done this. So let's see. Hold on. Back. Okay. So
They're rolling in, MaryAnn.
there we go. Okay. Do you guys see that? Can you see the poll? Launch. I got to click launch. Okay, something's not going right, Ruth. Help me here.
We're looking at the other poll is the one we want to take a look at.
Yeah.
I can jump in.
Okay, let's see if I can launch this one now. Can you guys see this poll? How familiar are you with data collection strategies?
Mm-hmm.
Okay, I'm going to end the poll and share the results. So it looks like everybody's either a little familiar or moderately familiar. We've got some that are very familiar. So this is good. I'm glad that we don't have any not at all familiar. So it's nice to see everybody has some familiarity with data collection strategies. And so hopefully, those of you that are very familiar, this will probably be some, hold on. Stop sharing. Okay. Okay, never mind. We'll cross that bridge when we come to it. Okay. Those of you that are very familiar, it might be just sort of some repetitive, it might be just, reinforcing some of the things that you already know, or maybe even just some different strategies that you might be able to utilize with what you're already doing in your community. Second poll question, I think this one might have been there already, but I'm going to relaunch it. Do you know the 4 core measures? So let me try to get rid of this one. I want to relaunch this poll. Okay. Do you know the 4 core measures? Okay, it looks like. Okay, so we've got about 45% that are familiar with the 4 core measures and about 55% that are not familiar with the four core measures. So, so this is good. We'll be able to help those of you. We're going to talk about the four core measures next. So we'll be able to help those of you that are not familiar with what those four core measures are. So four core measure questions. So the four core measures are basically the measurements that came down basically from the feds with the DFC grant. So when you get a DFC grant, these are the measures that you need to report in your evaluation. And these are the measures that have been determined to be the things that can help you measure use within your community. And then being able to monitor these four different measures will help you to be able to measure your effectiveness within your community. So when you're doing surveying, the very basic information that you want to get are these four core measures. So you want to be measuring past 30-day use, perception of risk, perception of parental disapproval, and perception of friend disapproval. And the parental and friend disapproval, research has shown that student use can be very closely tied to what their perception of what their parents think and what their friends think. So, so when you're doing your messaging or you're using your data, especially if you're using those positive norms, it's good to be able to say, you know, hey, like 90% of parents do not approve of substance use, or your friends don't approve of substance use. Being able to measure that sort of thing and share that information is very important. The substances that are focused on are alcohol, marijuana, prescription drugs, and cigarettes, tobacco use. Although in our surveys, DFC doesn't ask for vaping or ENDS use, but we include that in the surveys that we create. And it's also included in the MyFi at this point as well. So when you're asking these four core measure questions, this is how they look on the survey. So this is pulled from the survey that Dr. Lubbers and his team have created for us. And basically it's been approved by the federal government. It mimics how the questions are asked in the MyFi, and we'll talk about the MyFi in a little bit. But basically it's going to ask, during the past 30 days, so we're asking students about their own personal use. And then it asks, drinking alcohol. This second question touches on binge drinking, smoke a cigarette, use marijuana, use prescription drugs that are not prescribed to you. And it needs to be specific to using prescription drugs that are not prescribed to you. Use an electronic vapor product. And then we wanted to dig down a little bit deeper. So we always ask, did you use e-liquid with nicotine, with THC, or e-liquid that was just flavor? And then again, this is asking perception of risk questions. They rate whether or not they believe it is no risk to great risk. And again, take 1 or 2 drinks of alcoholic beverage nearly every day. Have 5 or more drinks of an alcoholic beverage, which is touching on the binge drinking. Smoke cigarettes, use marijuana, use prescription drugs. And then again, we get into the e-liquid, nicotine with THC. And then we ask, you know, whether or not they're using THC occasionally or regularly. Again, here's the questions dealing with what they believe their parents think and what they think their friends think. And then here is just a chart of how to break this out so that you can look at it. Again, we survey 7th, 9th, and 11th grade students because that's what the MyFi does. A lot of the national surveys will survey 8th, 10th, and 12th grade students, but we like to keep ours in line with the MyFi so that we can, because these questions mirror what's on the MyFi, we're able to monitor every year. So typically the MyFi is given here in Oakland County on every even year. So 2024 was a MyFi year. 2025 is the off year. So then we will implement a student survey, and we work with our coalitions who work with their schools to get that survey implemented so that we can get data every year. And so this shows, you know, what the overall is, and then we split out 7th, 9th, and 11th grade. And oftentimes when we're pulling our data together, especially when we're trying to create an argument for grant writing, we'll focus on high school use, 9th and 11th grade use, because typically 7th grade use is going to be pretty low. And so it's going to make our overall percentage rates lower. And when you're writing a grant, I mean, it sounds sort of counterintuitive, but when you're writing a grant, you want to be making an argument for what the problems are in your community. So you want to be able to pull that information that will make that argument for you. And that's typically using the high school data. And then this is just another way of being able to pull that information out, easy to read, easy to see. And this is reporting students who believe their friends feel it's very wrong for them to, again, it's typical. You're going to see it's going to be higher in the 7th grade, so this is have 1 or 2 drinks of an alcoholic beverage. Younger kids are going to believe that their friends think that it's wrong. And then that's going to go down when you get into the high school. I always find it really interesting. This is our student survey from 2023. There is really a low perception of risk when it comes to cannabis use across the board. So like here you can see 11th grade students, only 56.7%. There's a really acceptance, marijuana is safe. That's the message that young people are getting. They think it's much safer than, using alcohol, smoking cigarettes, all the way across the board. And then this is just showing ways that you can pull that data out and create little snippets of information. I pulled this from different key findings reports that we've created, and we'll show those a little bit more further on in the presentation. But this is just how you can pull that information and be able to share it in a way that is easy to read, nice to look at, instead of just a report that's just words. It's kind of nice to pull things out and use some graphics and make it so that it's interesting for people to look at. And then this slide is just talking about the MyFi. Again, the MyFi is the state survey. If you're not familiar with it, it's sponsored by the state. It's given every other year, depending on where you live in the state. Oakland County is on the even years. Some counties or some districts do it on the odd years. It's free. It is you get your own community or school district specific report. As a county, we can only pull down a countywide report, but the coalitions that have school district that are within school districts that implement the MyFi are often able to work with that school district and be able to get that data. So the MyFi is going to give you a lot more data than the bare bones survey that we implement. It takes a lot more time. Some school districts are hesitant to do it. So we encourage you to try to make those connections within your school district to either encourage them to implement this survey, or if they already do implement that survey, to be able to get that data and be able to utilize that for the work that you're doing in your local communities. This is just a sample of our bare bones survey that Dr. Lubbers and his team created. This has been approved by the DFC evaluation team. And it just asks those questions like we talked about before, and it's just 2 pages. It takes less than 15 minutes. We're basically asking a little bit of demographic information, and then past 30-day use questions, perception of risk questions, perception of parental disapproval questions, and we don't see it here, but the perception of peer disapproval questions, and that's it. So you're going to get your basic information. It's going to give you the information that you would need if you do have a DFC grant, but it'll also give you some good information that you can utilize when you are writing grant applications and or just sharing data with key stakeholders within your community.
And
And this is
MaryAnn,
just,
real
yeah,
quick, the one that you have there was originally created by DFC and the Fed, so people have an alternative in what they called their classic bare bones. The one on the next slide is our version, where what we additionally added are some like mental health and additional questions. But just so everybody knows, they're one and the same though. Those are the ones you were just showing absolutely we've utilized, but they're the DFC or drug-free community version of the bare bones.
okay.
Sorry about that.
Yep, no problem. Thanks for clarifying that. So this is our version. And like Darren said, we do add a couple more questions to it, but it basically has that basic information that you have to have. And it's much shorter and takes a lot less time. Some school districts and communities are hesitant to do the MyFi because of how in depth it is. You know, they get into sexual activity, suicidal ideation, some things that some school districts unfortunately don't want to touch on. And so when you can provide something that you know is a little less intense, some school districts are more open to that sort of thing. So this is just some quick tips for proper to be able to make sure you get your survey administered in an effective way. Census is the best. So you want to try to get all 7th, 9th, and 11th grade students. The MyFi does accept, I mean, you can just do a sampling, but in order to get the best well-rounded representation of the student body, it's best to do the census. So try to get a whole 7th, 9th, or 11th grade class. Try to choose a class that everybody has to take. So in other words, you don't want to do it in AP English, you know, because you're going to get the kids that are a little bit higher achievers, and you're not going to get a representation of the entire student body. So if every 9th grader has to take US history, then try to do it in US history or health class or whatever that class is that every student in that grade needs to take. Really important to stress that it's anonymous. We're finding that both adults and young people don't trust that they're going to be anonymous when they're on the internet. So with students, we're concerned that there might be some thinking that they're going to be tracked through their student ID or something. So we want to make sure that when we're implementing this survey, when teachers are implementing, you know, make sure that you talk to them about stressing that there is no way that their name or their number or anything is going to be tracked to their answers to the survey, so that we can get honest answers. Try to pick days when large groups of students will not be away for a sporting event or a field trip or something like that. Try to make sure that the survey is not within 30 days of a major game or a dance or a school vacation time or any other kind of event where there might be some drinking going on. So I think of like prom and homecoming and all those kinds of things. Just try to make sure that the survey is not within 30 days of those different events. Survey should be administered in the school. We've had some coalitions that if the school will not agree to implementing the survey, they'll try to gather surveys at community events or youth group events and stuff like that, which is okay. I mean, you'll get some data, but it's not going to be the highest quality of data in that, you know, having a large sampling and getting a full picture of the full spectrum of the grade levels and the kids in the district. You need to have parent notification. So passive consent is usually the way to go, which is, you know, a letter goes home, the survey is going to be administered. If you do not want your student taking the survey, then you need to let the school know. If the school doesn't hear from you, then the student is going to be taking that survey. And then it's really important to work with your school district to try to build some support for the survey. Oftentimes, sometimes the school district is a little reluctant. They don't want to, they're afraid that the survey is going to paint a picture that there's all these problems within their district. So it's always important to work with your school, your teachers, your administrators, let them know that the whole point is to not point out the problems, but really point out the positives, and then be able to address what some of those problems might be. Um, um, help them know how important this information is, how valuable the data can be, not just for you and your coalition work, but for the school district and for the work that they're doing for their students, to provide the best atmosphere and the best services for their students. Try to make those personal contacts with the teachers and administrators who are going to be implementing that survey. And then always make sure they know how much you appreciate that partnership and collaboration working together to get that survey. Okay, this next section is going to move into Dr. Lubbers, but before we do that, another poll. Which substance do you believe is the top concern for youth use among parents and adults in your community? So if we were going to ask parents that question, what do you believe parents would say? So top concerns. Launch. Okay, can you guys see that?
I do want to remind people to scroll down. There is one option that doesn't automatically show in the window.
Yep. There we go. Still getting a couple answers, so. Okay, I think. Okay, so it looks like majority of people think that e-cigarettes and vaping products, and then alcohol, marijuana, and prescription drugs. Marijuana being second, and then alcohol and prescription drugs. All right. Okay, you know what? Before we move on to this next section, I guess I should, does anybody have any questions about, the MyFi, the 4 core measures, the bare bones surveys, any of that data gathering to get that student data? Any questions or thoughts that anybody wants to share?
So MaryAnn, there is one question in the chat, Emily, and anybody can at any point use the raise hand feature. So I see a hand raised as well. Emily asks, do you have any advice for conveying to the students that the survey is actually anonymous, considering youth are consistently being told nothing online is anonymous?
That is a tough one. Dr. Lubbers, do you have, beyond stressing to that, like just telling them and being authentic and hoping that they trust you? I'm not exactly sure how to tackle that because, we can tell them, but you're right. They're being told everywhere that, nothing is anonymous. And I've had experiences where I talk about something and then suddenly I get an ad on my phone, that's kind of creepy. So, I understand their skepticism. I know that one of our coalitions in our network is going to implement their survey on a paper survey again. They're going back to a paper survey and to see if that has an impact on what they're finding as their results. But Dr. Lubbers, do you have anything to add to that?
Well, you really kind of hit it. Bottom line is it comes down to trust. And so what we typically include is a packet so that whoever's proctoring or administering the survey, that they're, you know, telling the young people in the room that this is truly anonymous. There's no way this can come back to you. It won't be tracked, etc. Now, if they believe that, you're going to get, better, honest responses. But to your point, one of our very large coalitions, they have a multitude of, private and public high school and middle schools, is going to, like MaryAnn just mentioned, they're doing it in paper because we're having such an issue. You have to remember that like our back, maybe 20 years ago, we'd have approximately 50% of especially the upper class grades reporting they drank alcohol in the past 30 days. Now, over the decades, substance use has drastically declined. There's no doubt about it. However, when we're concerned when we see, and we've seen this in some school districts where you'll have 0% of like ninth graders reporting any substance use. So something at times is amiss in terms of the trust factor that kids have in reporting substance use, and so I do think that it's all about the administration, but I love this new design that we're doing where we're going to try this in paper, where the kids will clearly know that their name doesn't go on it anywhere and they hand it back and see if we end up having to go old school again. It might end up being the absolute best solution.
Okay. All right. So let's move on now. Dr. Lubbers is going to talk about our parent and community surveys.
MaryAnn, I had a question. Sorry, I put my
Oh,
hand
I'm
up.
sorry. I'm sorry, Vicki.
That's okay. So how do you administer, I have a couple of questions. How do you administer the survey if you are using it online? Do you have a software? Is it a Google Doc? Is it a certain, like I said, program that, because the MiFi obviously is set up by the state. So I just wondered with the way that you're doing it, how do you administer it?
We
Dr.
we
Lubbers, you want to take that?
yeah, we create links. We use SurveyMonkey, and so we just create like QR codes or links, and that goes into, we have a professional account, so we have, an unlimited number of surveys that we can collect. So yeah, it's just like a link and that the schools would receive.
And do you feel that by, I guess, doing it your way, Oakland County's way, that you get more schools that will jump on this? Because I understand the frustration with the MiFi because, the one thing that I'm in Monroe County, and one thing that we're pushing, not me, myself, but the ISD person, is to encourage schools to do the basic version. So it doesn't include the extensions of the questions that schools are and parents are becoming more concerned about. So are you finding that more schools are willing to participate with the way that you're doing it?
That's a really good question. And I'd say the answer is, it's a mixed bag. We do work, like in different parts of the country and in Michigan. And for the most part, people like to do the state survey because it has, like some nice comparative stuff, let's say with your county, right? However, the downside of that is the length of the survey, as you know, and you're obviously familiar with some of the concerns that people have. I'm of the opinion that it isn't the survey itself, it's the administration of it, like what was already brought up, that leads to the issues. And so having like a really strong administration, like if you look at, any kind of testing or any kind of administration, that's the key to success. But the reason that we actually, a little history here, the reason that the Alliance created the first survey, that brief one, was because at the time the MiFi didn't have any good vaping questions. And we additionally wanted to have, because that was like what we were hearing from the schools, from the parents, from everybody, like, that explosion of the vaping problem. So we built questions in, and then we also wanted to know more specifically about mental health because that was one of our utmost concerns. So we created that survey, and people really liked it because it just didn't take as long to create. I mean, I'm sorry, to complete. And then, but we also have some districts that because of the kinds of interventions that they do, they like to do their own survey because they can ask kids in the survey, if they've seen these particular programs and interventions right in the survey, so they customize it. So they're much longer than the one that we kind of put up on the screen a few minutes ago. And they also like that because many of our our grantees that have like a lot of federal projects, they like that because they do seventh, eighth, ninth, 10th, 11th, and 12th grade. So that way they can compare it to national data and they can also compare it to county data by having all of those grades. So it's not quite as long as the MiFi, but it's certainly longer than the bare bones one. So we have a lot of hybrids of different surveys that specifically suit the needs of the community and the types of interventions they're doing. Sometimes we build in questions, that the school specifically wants to know about as well, and so that's the advantage. But like I said, the MiFi is a good survey too. There's a lot of pluses to that, um, in that it's a free and it's a statewide survey. So it's just like whatever fits the particular needs of the coalition.
Thank you.
I
Appreciate
answered
it.
your question. I probably went on a tangent like I always do. Sorry, I was a professor for a long time, and so you give me one question and I'll go like to all the things that are related.
So, Lubbers, you want to go ahead and start and talk a little bit about the parent and community survey?
Yeah, and one of the true strengths, and I neglected to bring this up when we were doing our introductions. I've also been participatory, in the alliance from the very beginning. And so one of the really cool things that I'd at least like to argue in terms of their growth is they've been such a data-driven organization from the beginning. And so I think that's been very helpful. I mean, we've had many, Washington, D.C. presentations, got outcome awards, and it's always been like a real integral part of the alliance is like data. And data, in my opinion, I know this is a little bit overarching what I'm saying right now, but in my opinion, and obviously I'm biased because, I'm part of an evaluation team, but I think it's been like instrumental in being able to not only select programs, as I'll share in a little bit, in terms of being, very specific to the areas of concern that particular communities have, but it also really enables you to leverage funding. Okay. And so part of what the Alliance has always done, and I mean for decades, is, we've been doing, as MaryAnn so nicely explained, our student surveys. And in the past many years, we do those every year. But we also do parent and community surveys. And what I really love about our parent and community surveys is we use what you call question logic. So it's like one survey link, okay, but then based on your demographics, like whether or not you have kids that are like middle high school kids, you get a particular survey. And then if you are a parent, but let's say your kids are 25 years old, you go to a community survey. But what we have in here are a lot of mirror image questions of the four core measures because you can see the topical areas in our slide here. We ask about perception of risk. We ask about the specific concerns, kind of like you just responded to in your poll regarding substance misuse. We ask how easy it is or access to substances. One of the questions I love the most, which we use over and over again, is how much additional prevention do you think would be beneficial for your community? And in general, people really think prevention is important. And so we're able to parade those really good data points all over social media and to funders, et cetera, et cetera. And so, it's very important that we do this across the entire county because, each community that completes their survey, assuming they get enough participation, they get a report so that they can also use that for their own grant writing or for their own key finding reports. So parent community surveys, very important. If you don't do them, start doing them. Excuse me. So here's just some examples of like the access questions. How easy do you think it is for teens in your community to obtain? And then you've got, just the primary substances, right? Because as mentioned earlier, there's a lot of, survey fatigue out there in the world. So the less is truly better in terms of surveys in our current day. Um, and then, the level of agreement with the following statements, these are just your concerns, right? And it helps get a gauge on like what adults are thinking, like do they believe occasional use of recreational marijuana by adults versus how do they think about use of marijuana by teens? Okay. And so really important questions to kind of gauge that differential, because a lot of people, are fine with adults using marijuana, but, are really concerned about how this is impacting our teens. And to me, that is the most valid concern that we have right now. So keep going, please. And perception of risk. So this is a mirror image of the teen version of the question. So as you can see, we have both. How much do you think adults risk harming themselves? And then they can go from no risk, slight risk, moderate risk to great risk. And then we're asking them about drinking 5 or more drinks of an alcoholic beverage once or twice a week, also known as binge drinking, smoking cigarettes, using marijuana a couple times a week, prescription drugs, etc. Then you ask about that same thing, but with teens. Okay. And then we kind of look at, we call it an incongruity kind of thing. Like, how differing do people perceive adult use versus teen use, like I mentioned a moment ago? Okay, so as a parent, okay, which of the following concerns you the most about your child's well-being? And this is that like super big list, okay, and they can list up to five. And then so we create statistically like a rank order of these. And, it's really interesting, by the way, when you look at how some of this has changed over time. Like, so several years ago, the various substance use type things would have absolutely dominated at the top of the list. And not that they don't, they still land there. But one of the biggest areas that you see parents concerned about now is mental health. And so you really see that. So one of the things that you're going to notice throughout our presentation is we report a lot of our data and information in terms of comorbidity, because what you really see is this sort of bi-directional relationship between kids having a lot of stress, anxiety, depression type problems and substance use. And so that is like a super important area of concern. Another thing that we've really focused a lot on, not only with our teens, but with some of our college projects, is social connectedness. And one of the things that you really find out there in the world today is that, you know, I think it was the Surgeon General who like really started this kind of movement, in terms of loneliness. And we're definitely noticing that our teens have been very affected by that. So much so, how I mentioned a moment ago, some of our communities do their own surveys. We have a lot of questions in those about social media use, texting, social connectedness, loneliness, things along those lines. And so, very important things to look at. But anyway, this gives us a cool grasp on the parents. So the next one, and this is, like I said, one of my favorite ones because we use it so much, prevention efforts. So I believe additional mental health prevention efforts are needed in my community. Additional or enhanced suicide prevention efforts are needed in my community. Now, we always find that people are very supportive and there's strong levels of agreement between needing more of that. So we have, Julie Brenner will use this, for example, our director from the Alliance, and use that kind of as a leverage point, like, hey, our communities want more prevention. We need more prevention. So it's a great data point to have. Um, So here we go with parent and community surveys in terms of just some of the logistics of it. So it's an online survey. Um, we typically do it like for a long stretch of time. We keep it open because, as MaryAnn mentioned a moment ago, um, we have like 20 some coalitions across the county that have varying like windows of opportunity. So we'll keep it open for like 6 months type thing. This year we only ended up with a little over 1,100 respondents. Like I said, there's a lot of survey fatigue out there. So that was a little bit light compared to past years. And like we mentioned a moment ago, a parent is somebody who has a child in 6th through 12th grade. We had a nice split this year with 48% community members and 52% of the respondents were parents. Okay, so now what I'm going to bring up, and this is particularly important when you start getting into different types of grant writing down the road. One of the things that they're going to absolutely demand, like with like some of the bigger scale SAMHSA grants, like Partnership for Success, as an example, is they're going to ask for what's called administrative data. And administrative data is, in essence, count data that is a very important part of your coalition portfolio. And what that really is all about and how you can obtain it is just having good relationships with your schools. And so they're definitely going to have data in terms of kids that were suspended, kids that were in some kind of a trouble point in terms of, tobacco use or drug use, and they have those kinds of categories. So we took this from a community and we just added some different numbers to it just because we didn't want, um, privately held data actually out there. But so, because I assumed some people might want to have this PowerPoint, so we kind of changed it around a bit. But as you can see here, how we typically look at this is we look at it in one way, we look at it by grade, and then we look at what are the percentage changes over time. And then we also then look at it by drug infractions. And so one of the reasons, by the way, that this kind of data is so critically important is you can look at, kind of like how the school conducts business in terms of are they very punitive, or can you as a coalition start adding some different elements? Like advanced coalition work has to do with policy change and, being able to do things, where you have alternatives to suspension. So it's really good to have this kind of data to kind of see like what are the trends in terms of, and as you can see in this example, we did 2022 through 2024 and are looking at these various infractions. So go to the next one. So here, in essence, we're looking at school safety and discipline data and state and community comparisons. And so, what's fascinating here with this particular community is if you look at, some of the differences, if you go, let's see, one, two, three, four, fifth column over, and you look at the percentage increase. So this would be what I would argue would be gold if I was writing a grant for this community. Because if you look at the percentage increases at this particular community with like tobacco use, so you could argue the point, well, why is that? Why do you have such a huge tobacco increase here in terms of discipline data? Well, you could argue the point that, we know that there's a lot of dual and poly use due to the, vaping increases. Um, or when you even look at the differential between alcohol in this community and the state, the increases are quite astronomical. Drug possession, 414% increase. Drug sales and distribution. Now, those are small numbers, which you get concerned about, not over-reporting small numbers because they tend to exaggerate differentials. However, Look at the bottom one, the marijuana increase in terms of from 2021 to 2022, you have a 414% increase. So on the far right column, we have like our multiple, the increase multiple. And so that's the kind of thing that you can basically write for to be able to say, what kind of increase we've had and why we need federal dollars to basically be able to leverage your point. So one of the things that the feds are going to always push on is having more than just survey data. Survey data is great, but it's limited. And so that's the kind of data that you really need to have. Now, another kind of important administrative data is treatment admission data. Okay. And so one of the things that you often see is there's a lot of treatment admissions, especially for our youth, in and around marijuana. Okay, but what this really is just one screenshot. This is some software that one of my team members developed. And so what we're able to do, like when MaryAnn gives me a call and she says, well, we're going to write a grant for this, that, or the other thing. And I want this particular age group. I want this particular substance. I want to know what the outcomes are, the admissions are. We have all of the state data that they give us every quarter. So we can take any data from any county and um, compare it to a PIHP, or we can compare it to the state level, or we can compare it to a similar county, or we can just trend it. And so this is just some software that we've developed, and it has all of the substance abuse treatment, admission, or treatment data in general, all of the outcomes for the entire state. So that's something we're really proud of. We have one of our team members that wasn't on our picture. He was also a software developer, and so that's how we've developed that. So it's very handy to have. So this is, by the way, just so you know, the favorite thing that we do from my perspective. I love this. Okay, so one of the things that we do is we look at what are the top influences. Okay. And if you really want to be able to have your programs align with like what's most important, I'm of the opinion that you really need to know what influences actual 30-day use. Okay. And one of the things, if you just kind of glance real quick at like the difference between marijuana, alcohol, and vaping, is you see that there's different like top predictors, right? What you see that's in common is that friends are the most influential source of the reasons that youth have consumed a given substance in the past 30 days. Now, how we do this is we're very fortunate that we have um, very large data sets. So we're able to do statistical analysis with things like logistic regression models and use what's called the dominance technique to look at what is the most predictive reason, for example, that kids smoke marijuana in the past 30 days. And then we put it in the rank order of influence. So we know in Oakland County, if you want to prevent marijuana use, and we do, we know we need to have an influence with friends. So some of the key finding reports that you're going to see in a moment, you're going to see friends all over the place with that because we know that's extremely influential. You're going to see us getting at the parents in terms of access. You're going to see our environmental scans that are trying to reduce access because we know that's the second most influential reason. Back to friends disapproval. Why do we have in our programs, that choosing your friends and having that kind of thing is so important because of this data point. We also know that parents matter, and we also know that kids need refusal skills or resistance skills. And then suicidal ideation and gender pops up as well. So it's similar with alcohol, right? Friends are the most influential, but then you have parental disapproval, presence of others, suicidal ideation, confidence to resist. Vaping nicotine, friends, confidence to resist, presence of others, suicidal ideation. And then back during COVID, mental health was a top predictor. And then being like angry for some reason was super influential. I'm not sure that would pop up right now as a top one. So, other thing that's really important in evaluation work is whenever you're writing a grant, okay, you're going to need to compare yourself to national and some kind of a county or state level, right? And so in this case, as you can see, in blue, you have the sample community. So this is just some community, and we hid the name of the community. And this is MS means middle school. So this is middle school data. And so as you can see here, actually, this would be really bad data to use for a grant because this community is doing extraordinarily well. The kids' perception of parental disapproval is higher than the county level, and it's higher than the national level for both alcohol, marijuana, and prescription drugs. So this would not be the one to use for a grant, but you do need trend lines and you need benchmark data, and this is benchmark data.
This one's good for bragging in your community about the
Yeah,
good
this is a
work that you're
bragging
doing.
slide. Thank you, MaryAnn. This is not a grant slide. It's a bragging slide. So here we go. Marijuana past 30-day use. Same kind of thing, but this one is looking at 30-day use. So you look at the sample community. Oh, I know which community this is. They're actually on this call. So if you look here, they're also, this is a bragging slide because you look at their past 30-day use in green compared to the county or compared to national. Okay, they're doing much better. And this is an example here of 7th, 9th, and 11th grade. So nice job. So here is just like looking at a simple trend kind of slide. Remember I was saying like how much substance use has declined. This is just even an example of prescription drugs. So, it has just gone down astronomically with both middle school, high school, and then the green line is just like a combined um, kind of number. Trending for alcohol. So in yellow, you've got your 7th grade. In blue, you've got 9th grade. In green, you've got 11th grade. And so basically, this is perceived risk, is what this is examining. So in essence, this is the kind of data point where higher is better. And so you want, perceived risk to go up. Okay, so remember I mentioned a moment ago, one of the things that's extraordinarily tricky, and particularly for grant writing, is, you're going to have most of the grants that we, at least in our space, write for are about substance use. So it's very difficult to speak to the idea of mental health if you don't look at it in relation to substance use and mental health, in other words, together. So what we do, okay, is we use what are called odds ratios. Okay, and these really are great because A, they're intuitive. So the reader understands them and they kind of signify, a connectedness between two things and also magnitude, right? So my first example here is just females are 3.8 times more likely to state that they have felt sad or depressed for several hours most of the time or all of the time during the past 30 days compared to males. Okay, so we know that that's nothing like new. I mean, when it comes to depression and anxiety. Females tend to experience that at a slightly higher, um, ratio than males. Okay. When with males, they tend to have, kind of rule of thumb is more what we'd call like the externalizing disorders. Typically you have a bit more when it comes to like conduct type things, ADHD, those kinds of disorders, or conditions. But so back to how do you use this in terms of your space and your world? Um, so when you look at high school students and being sad or depressed and past 30-day substance use, we know that high school students stated that during the past 30 days, if they felt sad or depressed for several hours, most of the time or all of the time, they're 2.4 times more likely to have drank alcohol. So there you go. Kaboom. You're making a power statement, right? So these things are related. They're 2.3 times more likely to have used marijuana in the past 30 days. 2.9 times more likely to have used cigarettes with nicotine, 2.7 times more likely to have vaped, 2.6 times more likely to have vaped any substance in the past 30 days. And that's compared to kids that were saying they were never or only some of the time sad or depressed. So odds ratios are a very handy thing to do. Now, how do you do this? Just so you guys know, one of the things that you have to have is you have to have raw data. Okay. And so that's why, like, we obtain for the Alliance all of the raw data when we do this with the MiFi. When we do it with individual coalitions, we're always getting the raw data anyway, because they're typically using either our survey or we're able to go through the superintendent and get the raw data set so that we can run these kinds of statistics. So it's not hard to do. You just have to be able to get the raw data.
Okay,
Do you have questions, Ruth?
yeah, any questions for this section?
I haven't seen any new questions in the chat. I just, about 2 seconds before you said that, invited people to either use the raise hand feature or type your questions in the chat. So if you have questions about that section, we're going to come back to other questions at the end, or you can put them in the chat or raise your hand. We're about halfway through at this point, so
Yeah, we've got like so much information to cover here.
Keep going.
I know we just like, that was a lot. That was a lot about data gathering. So, if we don't have any questions though, we'll just move on about focus groups. So, question, how many of you have ever conducted focus groups, and or one-on-one interviews? So I'm going to launch. Oh, wait, that's not the one I want. Go back. Okay. Okay, this is great. So the majority of you have all done focus groups or one-on-one interviews. So I am actually not going to like go into like really deep about how to conduct a focus group. We just kind of like, you'll get the survey for just to save some time. I just want to quickly kind of go over just some best practices. You want to make sure that you choose your topic. You don't want to cover too many topics in your focus group. You want to focus in on what it is that you want to specifically get information for. Make sure you have your target audience. Keep the group pretty small so that students are, and this is really focused on a student focus group, so that they feel comfortable talking. If the group is too large, some people might feel intimidated, or you just won't be able to get input from everybody in the try to do your best you can to have a welcoming environment. If you can have some food, if you can make it just really have the students feel very casual, try to build some degree of trust among the students. Have some questions ready, but be ready to kind of pivot if something comes, if the topic, if they start talking about something that is relevant to the information you're trying to get. Don't be so tied to the questions that you cut them off and say, oh, we got to move on to this next one. Let them talk. Free flow is really good in these sorts of environments. Another thing is, try not to direct the conversation in a way that you want to, and try not to state your own opinion. This is an opportunity for people to share their thoughts. And so when you start putting your own opinion in there, it can kind of skew things a little bit. Make sure only one person is talking at a time. So set some guidelines for students, assure confidentiality. Try to encourage everybody to speak. There's always going to be some quiet people in the group, and you don't want to, make them feel uncomfortable and put them on the spot. But it's nice if you can get everybody share what their thoughts are, and make sure let them know you want to hear all sides of the topic. Things that are positive and or negative. Questions should be open-ended. So try to avoid questions that they can give a yes or a no answer to, because they will. And then that doesn't facilitate good dialogue. Try not to, as I said before, try not to ask those leading questions or state your own opinion. Frame things positively where possible, and ask clarifying questions. So if a topic comes up, be prepared to be able to ask some clarifying questions that will help you dig a little bit deeper into the information that you're trying to get. You can record, ask students not to say any identifying names, but then you can record your focus group. But it's always good to have a note taker there as well. So usually there should be more than one person conducting the focus group and somebody taking notes. Once you do your focus group, try to organize your thoughts and the outcome right away while it's fresh in your head. If you wait a few days, then you're not going to remember as accurately what happened in your what happened in the moment in your group. And do not write down any names of any individuals who are part of it. Again, this is just kind of some effective ways to run your focus group. I'm not going to spend a lot of time on these questions. These are just some sample questions that you can ask, and then how you can kind of move through those questions. Again, you guys will get a copy of this, and you'll be able to look through this yourself. But this just kind of goes into, these are the results from a focus group that Dr. Lubbers and his team did, and what was pulled out from the dialogue. So you'll see, talks a little bit about what the discussion was about. And then in red here is what the key point was that was able to be pulled out from that information. So students reported consequences of drinking were also brought up in terms of having a car accident, families distancing themselves, losing someone's job, harming one's reputation, and then regretting one's actions. So just some examples of key information. So again, here the same thing. When asked if it was okay for teens to drink certain types of alcohol, there were conflicting views. And a little bit of dialogue about what was discussed. But the key point being, it was also noted that risks are higher for youth as their bodies and brains are still developing. Great to know that young people are aware of that information and that they are at higher risk for addiction. Lastly, respondents stated that they have learned of the risks of alcohol from classes, parents, and observing their family members with side effects, as well as those who have passed from their alcohol use. So good information about what young people are experiencing directly within their communities. Here, a discussion about legal age limit. There are opposing stances on whether the legal drinking age should be lowered. A little discussion about what that was. But the key point is the majority of respondents lean toward maintaining or even increasing the legal drinking age due to addiction, the developing body, and other risk factors associated with underage drinking. Same here, just in discussions about access. So respondents overall agree that alcohol is easy for teenagers to obtain. Key point, it was mentioned that teens can obtain alcohol through friends and family members at parties or by using fake IDs. So this is really good direct information about how to address access to alcohol when you can pull that directly from young people as to where they're getting it and how they're getting it and where to target some of your prevention messaging. They go on to talk about gas stations, corner stores, and big box stores as locations where alcohol can be sourced. Key point here, having adults buy alcohol for minors or gas station attendants not IDing were noted as the easiest way for teenagers to access alcohol. So again, trying to get that information out about adults providing alcohol to minors. Respondents mentioned ways to prevent teen access to alcohol include stores being stricter, using a scanner, parents talking to their children. So again, being able to take this information of what young people specifically think is going to help and utilizing that and putting that into your campaigns and your messaging and where you're directing those prevention efforts. Dr. Lubbers, you were going to touch on the success that we found with our developing this 21 to buy not supply from focus groups.
Yeah, like this is one of my favorite examples of like how you know, that kind of quantitative and qualitative blend of data is so powerful. Like this started you know, many years ago when across Oakland County we were doing a particular evidence-based practice called CMCA, or Communities Mobilizing Change Against Alcohol. And what we did was we did focus groups with like youth, police, parents, you know, actually several other sectors. And we also did what are called one-on-one interviews, which is like a qualitative methodology where it's like semi-structured questions in and around alcohol for this particular design that we did. And what was so fascinating about the results that we were able to receive back then, we didn't have good survey questions in terms of how kids were accessing alcohol. So one of the key things that we were able to do is modify our surveys and start to build in better questions on access. And the other thing that we learned from those one-on-one interviews and focus groups was that a lot of the kids were obtaining alcohol by someone who had recently, you know, turned 21. So older siblings, older friends, that kind of thing. And then through our interviews with law enforcement and police, they were kind of like, well, yeah, I mean, it's important, you know, in terms of like, we know that, you know, at times like the good old shoulder tap, you know, hey, can you go buy me this kind of thing happens, but it's hard to, you know, monitor all of that. And so, through a whole lot of digging and research, we also found that there were perfectly good laws on the books already, meaning there's a huge fine associated with supplying to an underage person. Um, and, you know, we were able to then create this campaign, you know, called 21 to Buy, Not Supply. And I believe, MaryAnn, we even partnered with Secretary of State on that. So we were able to let people know basically when they were turning 21, like, hey, think before you buy alcohol for your underage friends, because like it says right on the slide here, it could cost you $1,000 in fines and up to 90 days in jail. So in other words, is we were able through this focus group and one-on-one interview, you know, sort of journey, all started with the qualitative work that we did, create this campaign that is still like very powerful and out there today. And so to me, it was just a really great example of, you know, qualitative data leading to a great long-term community intervention.
Does anybody have any questions about focus groups? and their value as we, before we move into determining key points? We're going to move on. Tell you, Dr. Lubbers.
Okay. So here's like a absolute true statement. Most people are not going to read an entire My 5 data report. I don't know if you ever seen these, or for that matter, Youth Risk Behavioral Surveillance System report or University of Michigan Monitoring the Future report. These reports are big and thick, and they're just rows and rows and columns of hundreds of data points. And so when you get sent that data, no matter what your data looks like, it's just too much to, utilize in terms of, like people at the high school or middle school or parents or, really any community stakeholder for that matter. So, one of the things that we've done over the years, which we think works quite well, is we really create, key issue or key finding reports. And in essence, they're summaries of the data in terms of, some of the main things that we want to convey out there in the community in terms of the data points. Because, like I mentioned, nobody's going to read these full reports, or very few people. I mean, we do, but I'm just saying most people aren't going to go through that process. So, what are the key issues that the communities are particularly interested in? Often we're including some of the 4 core measures, past 30-day use. Maybe if we know a report is going to go to parents, we want to let them know that, like, 9 out of 10 youth, know that their parents would disapprove of them, using a given substance as an example. Communities are very interested in mental health access. I mean, as you already probably know, most teens are accessing alcohol at their parents' home or a friend's parents' home. So it's good to like let parents know that they are very influential in being able to prevent access. Perception of risk, as you saw earlier, kids knowing how to um, resist, or what's also called refusal self-efficacy, is critically important. Friends are absolutely important, and resources in your community are super important. So those are some of the key areas that we focus in on with these key finding reports. And these are great examples. And MaryAnn and the Alliance have like a really nice capacity to be able to build these in this very like friendly way. So, you know, as you can see here, like presence of others is on like a really cool data point here. Knowing that kids have a confidence to resist. And what's important when you create this kind of thing is you want to make sure you have a data point in your key findings. But in addition to a data point, you need to refer to the grades that the data point is referring to. Because as you know, if you average in middle school kids, that's going to change your percentages quite a bit. So it's important for the reader to be aware of that. So these are just like a variety of examples of like super important areas of focus. And you can see on the right-hand side, as I mentioned a moment ago, communities are very concerned right now about teen mental health. So we've really included a lot of that in our key finding reports. And also, as you can see at the very bottom, asking for help. And so, kind of letting people know like where they'd ask for help, but then also we put a lot of information about there out there in terms of community resources, in terms of where additional help is available. So absolutely a great way to get data out there is through this kind of reporting.
And I'm just going to add, I mean, we're fortunate that we have a marketing group that we work with that serves as like our art department and marketing group. But Canva is great. Being able to, take this information and create stuff in Canva. It's really, if you haven't worked with Canva in the past, our prevention team utilizes it a lot, and it's really user friendly. Really good way to be able to create some of those, create, nice graphic looking key findings reports. This is just another example of other pages, and I just, for the sake of time, I just kind of went through that real quickly. But again, you guys will get this PowerPoint presentation and you'll be able to see examples of how Dr. Lubbers pulls that data together for us. And then we feed that information to our marketing team, and we're able to create these really, really eye-pleasing pieces.
Yeah, and so like, just to remind everybody where we started, how do we get all these? Obviously, it's through the student surveys and through the parent and community surveys that we have such rich data to pull from. And so
And
having some of these things on here too, where we send out messages like through social media. Remember I mentioned like the ability to say, no, I'm going to resist using alcohol and friends. Remember, those were two huge data points in terms of the top reasons teens use. So we put a lot of messages out there, at least saying that, hey, 72% are able to, they're very confident to resist. Mental health prevention efforts. Remember, I also showed in that parent survey that that's what community members and parents truly believe is that mental health preventions are needed in the community. So that is like critical to get out there, that's what our community is telling us.
And again, these were created, we have our own in-house social media person. And so she creates all of our social media posts, and this is all done on Canva. So really, great tool for being able to create nice graphics and get that information out to your community.
And
more examples here.
Yeah, more examples. And by the way, though, it's like one of the things we've learned over the years is that communities are not going to tend to want to get that nice 10-page report and read it. They love these like little data points that kind of pop in, and we send a lot of information out there, but we tend to use more small amounts of information but regularly occurring, we think is a more effective strategy than, like the big huge data reports. So yeah, just more data points here.
And again, you'll see, that we like to, and we'll talk a little bit about positive, putting out positive norming messages, but whenever possible, we try to frame things in the positive so that we can, show like the majority of students aren't using, rather than focusing what the problem is. We try to focus on what the strength is in the community.
Yeah. So another like very important concept to add to your like kind of prevention kind of action item, I would argue, is intercept surveys. And so one of the things that I think it is like very important to know is if people are observing your campaigns and your initiatives, and do people think in the community that your campaigns and your initiatives are effective? And so the basic concept behind an intercept survey, it's one we kind of modified from, like a social norms kind of theme, which is you take an image of the campaign, and then in essence you ask people in the community. So maybe you're at like, a farmer's market, or you're at an event, and then you have like, you could do it with a hard copy, but we tend to do it electronically, where the survey taker is going to see an image of that campaign. And then you're in essence asking them if they've seen that campaign before today. And then you have a question basically saying, like, I'll just give you the example from the first one, the Lock It Up campaign, getting parents to lock up substances. Do you believe the Lock It Up campaign will encourage adults to securely store alcohol or drugs from those that are underage. And then in essence, then we're able to get data on whether or not campaigns are being observed and the perceived effectiveness. Do they understand what this campaign is really trying to accomplish? And so this is really important. And by the way, the feds love this concept because it's kind of a little bit of a void out there in like really knowing like what's being observed and what is the effectiveness. We really are encouraging all of the communities we work with to do more of this kind of thing. And one of the things you have to always be prepared for, though, is we as preventionists think everybody's seen it. But then when you actually go, and remember the idea behind an intercept survey is you're in the community asking these things. So it's like a proxy for randomization, meaning an event any person in the community would go to. And so it's very important to realize that sometimes your campaigns, people haven't seen them. Like the example here with the Alliance one is they've really gone big on that Save a Life, the Narcan training. And so you can see from, the past couple administrations that a lot of people have seen that campaign. But the Parents Who Host Lose the Most campaign hasn't been observed as much. Now we know why, though. We haven't pushed it out as much. So then we have the logical question of, do we need to get that out more? Do we need to do that more in billboards? Do we need to do it more in social media? Depending on the time of year and what our area of focus is. So this is just the data regarding these things. And this is just more examples. We do this with all of our campaigns, Parents Who Host, that 21 to Buy campaign. Now, this is really a cool one, though. This is the perceived effectiveness of the Parents Who Host Lose the Most campaign. As you can see, the gradient here of the Likert scale response options, it goes from 2022 and 23, where we administered this, and people could rate that program definitely won't, probably won't, probably will, definitely will have like the intended effect in terms of having parents refrain from allowing teens to drink in their homes. And as you can see, like what's cool here is we have a bigger proportion of that light blue of probably will and definitely will. So over time, the perceived effectiveness of this campaign has increased. And that's what's really good about this data. We know that, it's being seen. We know its effectiveness or perceived effectiveness. Do you want to cover this one, MaryAnn?
Yeah, just quickly, I'm guessing a lot of people have probably heard of the science of the positive. We really try to focus a lot of our messaging and the work that we do around this frame, the power of the positive community norms framework. So basically, the science of the positive is the study of how positive factors impact the culture and experience. The focus is on how to measure and grow the positive, and it's based on the core assumption that the positive is real and it's worth growing and it's present in ourselves and our families and our workplaces and in our communities. So rather than focusing on, the old, like really negative, scary images of people who have a substance use disorder or all the negative stuff, the car accidents and sort of the norm of how things were portrayed in the past. It's really focusing on those positive things and trying to share that positive, and that, when you share that positive, that's going to grow. And so it really deals with the gap between what is actually happening and what the perception is, and then trying to really address that gap and make sure that people understand that there is actually more positive things happening than negative, because we all have that negativity bias, and people tend to focus on that negative more than the positive. So we try to focus on promoting positive in our communities. We have a very strong partnership with Oakland University. So this is just how We do a big survey at Oakland University twice a year, and we've been running this positive norming campaign primarily focused on mental health we're in our 7th year of working with Oakland University. And this is just an example of some of the messaging that we put out there. Basically, just showing, most students don't party hardy at Oakland University. And then again, utilizing most students think it's a good idea to utilize mental health. Again, this is just quickly, this was actually developed by young people at Affirmations in Ferndale, which is an organization that supports the LGBTQ plus community. Young people worked together to create this message. And we put it together in a poster for them. And then this was a poster contest that we had that just talks about, reasons to be above the influence of substance use. So utilizing that positive data to share your messaging in your community. So we need to get into, this is important stuff here. So we need to get through this determining disparities in your community. So Dr. Luber, first a poll quickly. If you were required to write a disparity impact statement, and if you're not familiar with that, it's basically a lot of the federal grants are asking you to create a disparity impact statement. So identifying what the disparity is in your community, and then how you're going to address that. So if you were going to create one for your community, what do you think the focus for your community would be? Would it be race, ethnicity, gender, sexual orientation, or socioeconomic? Or just a few of the options that you could choose. So pulling up that poll. Okay. Okay. Still have some coming in. Okay, so our results, majority of people would focus on socioeconomic, but we do have a few people who would focus on race, gender, and sexual orientation. Okay, Dr. Lubbers.
Got it.
Well, we can get through this quickly. I mean, because we need to talk about this, and then also we want to make sure we touch on like how to utilize your data for writing grants, and we want to leave some time for questions at the end. So we've got about 20 minutes or so to get through these 2 sections, just to kind of, give you that time frame.
Yeah. Okay, cool. Well, and just so everybody knows, like, the disparity impact statement is, like, in my opinion, one of the strongest changes in terms of area of focus that the feds have really engaged in, particularly, with like certain types of grants. So you really have to get good at determining pockets within your communities where, there's a given the term they use is subpopulation within your community that hasn't had equal access to like prevention. And it is so important that we're able to identify areas within our community where we want to have like this sort of you know additional focus. And so that's what these things are all about, like looking at differences. Now, in a lot of our early grants focusing on disparities, we often use like the male female thing because we were finding in a lot of our communities there was definitely a large gap between females, which you can see in the green bar, and males when it came to this particular one is nervous, anxious, or scared. But you typically we would see this with, depression, anxiety, stress, whole host of different mental health areas. So a lot of our grantees did select gender as one of their disparity issues. The key to realize when you're, kind of jumping ahead into like some of the grant writing components, you have to have data. You can't just say it. I mean, you need to have like data points that validate where your disparities are. So this is one way that some communities have gone, is the gender disparity. And this is just making my point, like across the board, um, in Oakland County, when you look at this, you just have, depression type indicators, irritation, annoyed, angry, nervous, anxious, a far greater area of concern. So this is the reason these numbers are so high, though, is remember that in this particular scale, it's showing at least some of the time, and so in other words, there's different gradients of levels of mental health concern. Now, the other thing that you can do if you have a large enough catchment area or county is you can look at things which we have done in like, urban and non-urban disparities. And so, for example, this enabled us, this particular data, to look at, like differences with like marijuana, and you'll see in a moment like alcohol use, because you see differences in Oakland County with urban versus non-urban kids. Whereas when you look at, past 30-day use, our urban youth were slightly using marijuana more in the past 30 days. But here's the key. The key is they perceive that their friends' use is quite a bit higher, and they perceive that the typical student is using marijuana quite more frequently, than in the non-urban communities. So this gives us some real evidence on some things to focus on, and for that particular grant. Also, when you look at urban versus non-urban with marijuana, it's easier to obtain in our urban areas, and the perception of risk is lower. Okay. Now, though, jump into alcohol, and you see the opposite case. Now you see the non-urban using alcohol in the past 30 days quite a bit more than in our non-urban communities. Their perception of friends is significantly higher in the non-urban communities with alcohol use, and their perception that most kids are using is also substantially higher. Okay, so you've got like true disparities here. Now, you also have, the point of the non-urban kids are saying, yeah, it's, pretty easy to get. About half of them are saying it's easy to get alcohol. And the perception of risk is actually a little bit higher. So this doesn't make our argument for a grant, but it's just good for us to know. Now, the other thing that is very important to look at when you're looking at disparities is you can look at, like this example here, the perception of risk with marijuana. And on the left-hand graph, you have it's a trend line, right? And you have your high school Hispanic kids versus the high school non-Hispanic kids. And as you can see, the perception of risk is lower with our Hispanic kids. And it's the same thing when you look at the middle school Hispanic kids. So this works perfectly wonderfully to be able to know that, we're going to need to get some prevention strategies in place to work with. And this is actually a group that we did select as a focus area for in our disparity statement for one of the grants that we worked on with the Alliance. And we did some really good things with that. Now, the other disparity group that some people select for all of the right reasons is sexual orientation, gender and sexual orientation. So this is like a super long slide. So I'm gonna go through this like really quick and zero in on what you really need to know. So when you look here at our LGBTQ plus group and you look at past 30-day use, Okay, look at that blue line with alcohol. You can see our LGBTQ kids are substantially higher than our cisgender males and females. Vaping THC is their number two substance used. Once again, substantially, I mean, statistically significantly higher. And marijuana use, same thing. Even though it's the third on the list, it's actually higher than males or females in terms of cisgender males or females. And so the other thing, by the way, at the bottom, you can just kind of look at, like I said, a lot of groups have selected the male versus female in the past, and then you can look at the differences. And so it's super important. I know it's basic, but a lot of times when we think about prevention, we don't like split these things out. And it's like super important to know because like the different kinds of programming and strategies that you do, you need to know what these top substances are, and you need to understand the differentials in use with your data. Um, and you know what? I think we can kind of move past this one because it's much of the same.
Mhm.
Um, but here is a really cool environmental scan that one of our communities did. This was out.
Uh-oh, Darren's frozen. Darren, you're frozen. I don't know if
That in
Darren,
areas that were part of their you
Darren, you froze up like right at the beginning of the slide. So can you?
oh yeah, thanks for telling me that. I didn't notice that. It didn't pop up on my screen telling me that. So this is a geomap with a major report that we had worked on with Genesee County. And what's really cool about geomaps is A, it's pretty intuitive to see, but what we were interested in, our hypothesis was that we were going to have more dispensaries clustered in zip codes with lower median incomes. And we did find that. And so the argument is like, why is that? And so it's back to what is good prevention work all about? One of the things that we have to get really good at is looking at local ordinances. We have to look at, what's put in place, you know, um, to like not have this kind of saturation. And so, they're kind of like struggling with that in that these lower median income areas have the easiest access to dispensaries. And so we have like this whole like lists of things that we examine in terms of the policy and the ordinances in terms of the dispensaries. It's a really cool report. But anyway, geomaps can help you with disparity. Um, Now the other thing to actually look at disparities that I think is like super important is you can look at ethnicities and look at differences with this particular community. One of the things that we're encouraging them to do is take your eye down to the row that says Black or African American. Now, in this particular community, we're concerned that there's more incident data, meaning more infractions, kids are getting into trouble at school at a higher proportion. It's a disproportionate number in terms of getting into trouble with tobacco or drugs based on the proportion of their population. So, in other words, what we're saying is, why is that? We want you to talk to some school people. Is there something going on here that, we're concerned about? And this is very helpful, though, in terms of picking a disparity group to possibly work with in terms of grant writing, because we know that those kids are, experiencing more school infraction data. But also leads you to the question of what would you do in your grant? Well, maybe you have an alternative to suspension program. I'm of the opinion that the worst thing you can do with a kid is kick them out of school. They need to be in school. And so this is like important data for them to look at, but we very much point this out to them that this might be an area of focus for their grant with this kind of disparate incident data.
I'm gonna go past these real quick. This is a data tool that Dr. Luber's team is working on to help pull out different disparities. You can put in different demographics and different substances. But I'm gonna just kind of go past that quickly so that we can get into this last section of using data for writing grants.
Okay.
And I'll let you take that, Dr. Lubbers. Just point, so these slides basically, the section in red this information is taken from actual grants that Dr. Lubbers has worked on either with us or other organizations to write grants for federal funding, and how that data was used in the narrative to make the argument for the need for the funding.
Yeah. And so what I did was I took the names of the communities out of all of the statements, but to MaryAnn's point, this is very specifically from actual awarded grants. And so this is just sort of to point out to everyone, how like everything we just talked about earlier, this is sort of like the final stage, right? Where then you have the data, and then we help write in power statements that are data-driven power statements in terms of making the argument, the through line, so to speak, that hey, we really need a grant because we have some issues here. And so, like as you can see in red, data indicates that Oakland County students rank lower in perception of risk and perception of friend disapproval, and higher in perception of friend use compared to the 2021 AYPS. We also then write later here, 2023 countywide student data indicates the perception of moderate or great risk for taking one or two drinks nearly every day is decreasing from 7th through 11th grade students. We got 70.4% for 7th grade, down to 68.4% for 11th grade. Perception of peer disapproval. So, in other words, all these numbers are going in the wrong direction, and so we're making that point through data on what's going on here. And there's all sorts of ways you can weave the data in once you have it to make these power statements in terms of what's going wrong in your local area. And then, of course, what you're doing in your grant, though, is you're arguing with your action plan what you're going to do about it. Now, remember, I mentioned earlier too, every community, in my opinion, needs to focus on both substance use and mental health because they just walk hand in hand. And so, one of the things that we put in almost every grant we write is, like the example here, students reported past year alcohol use are 2.1 times more likely, we put in caps, to report feeling so anxious or stressed they found it difficult to do their work, take care of things at home, and get along with other people compared to those that did not use alcohol. For 12th grade students reported past 30-day alcohol use, they were 2 times more likely to be depressed or anxious. So that's a big number we have in this particular community. 762 kids had both anxiety and alcohol use in the past year. So we took it out of percentage and used just a raw data count to make the point that we're not talking about a half a dozen kids here. We're talking about closer to 1,000 kids who are experiencing this kind of comorbid issue. Makes a very strong argument. Next one, we also often use this one that I really like. And I know this is like pretty straightforward, but pointing out to the reader that use is increasing from 8th grade to 9th grade to 10th grade to 11th and 12th grade, right? And that we have these like increasing levels of use. And then we also throw in this particular grant, Talking vaping was one of the things that we were focusing on. Um, they were more likely to also be depressed if they were vaping. And so it gives us that ability to do our programming then that focus on mental health and substance use. Um, so I like this one too. Back to alcohol. Most of your grants, you're going to want to include alcohol. But in 2022, high school students stated they drank alcohol in the past 30 days were 2.2 times more likely to state they felt sad or hopeless every day for 2 weeks or more in a row. They stopped doing their usual activities in the past year compared to those that did not drink alcohol. So once again, these problems hang together. And you want to point that out, though, so the reader gets that and you have an alignment between what you're going to do with your community interventions to do both. Now look at this one. This is a really high odds ratio. In 2022, high school students had stated they used vapes or e-cigarettes in the past 30 days were 4 times more likely to state that they ever seriously considered suicide in the past year compared to those that did not use vape or e-cigarettes in the past 30 days. And then I have at the bottom here just to highlight that alarmingly 15.5% of high school students seriously considered attempting suicide, and 7.9% did actually attempt suicide. So, it doesn't get any more important than that, right? To have that kind of data point, be able to argue that you're going to be able to put things in play, to assist your young people with that kind of extraordinarily concerning mental health problem. And then remember, we talked about in our disparity section, LGBTQ. In 2022, high school students that identify as gender variant are 4.1 times more likely to state they've ever felt so sad or depressed that they had thoughts of harming themselves in the past year compared to males. There's several areas where service gaps, and what I like about this is we're pointing out that, hey, we don't have anything right now to address this thoroughly. Okay. So we're going to need to have this infrastructure development and trauma-informed prevention messaging. Okay. And so once again, using data to make your point and aligning it with your interventions. And so what I just like weaved you through really quickly was like grants from several different community grants. Some of them were PFS and some of them were probably DFC, STOP grants, so, but it always works having data to make your point. So that's it. I did it as quick as I could with that section.
Bravo, bravo.